That's amazing. I'm so proud.
Thank you so much. Chelsea is on. She was the editor, and we worked really closely on the project together. So
Awesome.
I'm psyched for you to meet her as well, because I think, we all have our reasons for wanting to do projects related to this issue. So I was just so excited to find Chelsea, who was really in alignment with the project, and we just worked together really well and we're able to do it. And I can't believe the response. And thank you so much for being involved.
I honestly, I feel like it was a complete privilege. I still feel like I can't believe that I got to be part of that, and to see these incredible athletes, to hear your beautiful, vulnerable story, even though I knew some of it from you, the way you wove it in. I just have had so many patients who've listened and who, not being climbers themselves, have just been like, this was so helpful. This was really important to me. So both of you just healing people, it feels amazing.
Wow. I mean,
Yeah.
it's more than I could have ever, hoped for. And thank you for sharing it. It was hard because I don't have the answers, and I knew in the film I couldn't just put like a happy button on it. So I'm glad that trying to be honest resonated with people.
Yeah. Well, clearly it did. How many views are you up to now?
I don't know. I haven't looked recently. Maybe, hopefully close to 180,000, maybe 170,000. And it's being translated into Japanese and Russian and German right now. And a Japanese article is about to come out about it. And there's a Russian publication doing an article about it.
I have total chills. That is phenomenal. Phenomenal. It's so exciting.
I mean, thank you so much. It wouldn't have been the same without you.
Like I said, it was completely a privilege, and it was a privilege.
It wouldn't have worked without you. The science and just the wealth of knowledge that you have, and people can put trust and faith in that. And then on top of that, your delivery and just how warm you are in terms of delivery of that information. We couldn't have made it without you.
I really appreciate that. I mean, I think what's so important that, I know, is that this country has a weird relationship with respecting hierarchy. And sure, it's nice to respect people who've done certain things, but the most important thing is for me to take my privilege, which includes my credential privilege, and then lend the entire topic support and completely validate your experience and your need to bring this to light. And if that provides a stamp of science or realness to it, great. But I'm really aware that my role is to be what she said. Yep, that's the thing, and I love that. It's fantastic, as a woman, as a feminist, I think that's a great role that women can play for each other, to lift each other up and sort of bring whatever we happen to have and be like, how can this help you? Let's figure this out. So I think it.
Awesome. Yes, definitely. Well, thank you so much. Maybe we can just go ahead and start. People will.
Real quick, Caroline, I think you have to give me permission to record within this new meeting.
Okay.
And then what's the format today? How are we doing this?
Informally.
Great. Awesome.
Dr. G, I wanted to give people a chance to talk to you, ask you questions. There have been so many questions from people since Light came out, and I definitely, focused on more of the emotional aspects of people's stories, and just didn't have time to go into all of the amazing, your amazing wealth of scientific and medical knowledge, as well as, kind of emotional interpersonal experience that you have about these complicated issues, and, the normalization of diet culture, and what happens to people when they do deprive. And, there's just been so many questions. People have been like, well, do I have a problem? And I've actually heard, I've gotten thousands of messages since light came out from people. And one of them was from a male doctor who said he has been struggling with an eating disorder for 15 years. And so it kind of like makes me tear up, you know. It's just, every message I get is just amazing. I've gotten messages from moms who were worried about their daughters, and who said that they watched the film together and it was the first time, like time they were able to talk about it together. So anyways, I know that's like a really broad sort of intro, but
I'm just seeing these amazing people who have joined, and I just have to say hi and wow. So that's what I just wanted to start with.
oh, and also Angie is here. She only has 30 minutes. So maybe Angie, actually, maybe we should focus on you first if you have any questions.
Oh, okay. Yeah. Sorry, guys. I'm at like a family thing. And so if I'm going to mute myself for most of the time. I'm actually currently like in a child's room with like weird backlight. And I'm sorry, Caroline. I know it's not like the best.
It's perfect. Thank you.
Not the best video setup, but can you hear me though?
Yes.
Okay,
Yes.
cool. Hi, everyone.
And it's real.
Oh, it's very real. As real as it gets. I forgot my brush on this trip, so I'm just. This is how I woke.
Super optional.
Pretty much how I woke up.
I love it. I'm so excited for you all to meet Dr. G, and for Dr. G, for you to meet a few people from the film.
I'm super, like starstruck, quite frankly, to be sort of sitting on a Zoom with you guys. So this is amazing.
Very nice to meet you.
Well, Dr. G, do you want to start with a little bit of your background, or where do you all feel like we should start here?
I'll start anywhere you want. I'm happy to give a quick background, but I'm also, if the listeners are going to kind of already know this, and I'm more than happy to jump right into questions, whichever you prefer.
All right, let's jump into questions.
Okay, great.
Who's first?
You can't put that evil on people, Caroline.
Okay, so I will start with a question. I would love to know, Dr. G, what happens medically and scientifically to our bodies when we deprive ourselves of food and maybe over exercising as well. I wasn't able to include this whole cycle of events in the film, and I think it's really important for people to hear from a professional like you.
I would love to answer that question. So when I talk to my patients and their families about what happens to humans when they underfuel relative to what they're asking their bodies to do, and this happens in people of all body shapes and sizes and all ages and all genders, there's a part of our brain that I call the cave person brain, which is the part that evolved to run our body functions below our conscious awareness. And it evolved specifically to keep us alive in the face of undernutrition, which is how we're here today, because our ancestors very, very kindly evolved this cave person brain to be hyper responsive to the sense that we're not getting in enough nourishment. So even within a couple of days, much less sometimes the weeks, months, and years that people may experience this, our brain goes, oh, I see there's a problem. I will take care of you. I'm gonna show up here for you. And it changes completely how our body functions in order to try to preserve our body weight and to keep us alive and keep us ticking. So some of the things that people experience medically as a result of undernutrition include a slowed heart rate. Because for instance, when bears hibernate in the winter and they're not eating, they have a high vagal tone, it's called, and they slow everything down because you don't want to spend extra calories on extra beats of the heart. But what athletes and others with an imbalance between intake and performance may notice is that they'll have quite a slow resting heart rate. But if they get up and do almost anything, their heart rate goes much faster. And there's that imbalance of being like, oh, well, I sort of thought to myself that my heart rate was slow because I'm an athlete, because I'm such a high-tuned machine. But in fact, it's your body slowing down your metabolism to try to save your life from malnutrition. And that's why your heart rate goes slow. A really well-nourished, well-rested athlete may have a modestly slow heart rate at rest because it's got a beast of a muscle and it's pretty efficient. But when you walk down the street or when you climb a flight of stairs, it does not change that much. And that's one of the ways of distinguishing an athletic heart from a starving person's heart. And it's so important when I say starving person, I don't necessarily mean thin person. I'm going to keep saying it over and over again that malnutrition can happen at every possible body shape and size. Okay, so that's the heart. The digestion slows because we don't want to waste a calorie on a wriggle of the intestines. So when people haven't been nourishing for a while, they'll find that they feel more bloated, more constipated. They get full pretty quickly after eating and might feel a little bit nauseated. And of course, the easiest thing in the world, if there's an underlying eating disorder, is to think, well, see, I'm full. I'm just listening to my body. And that's what everybody tells you to do. Just listen to your body, listen to your hunger cues. But your body is trying to save your life from inadequate nutrition. So those aren't cues you can rely upon when you haven't been eating enough. And we get cold hands and feet and a sense of general chilliness, which drives people to seek more sweaters and more hot drinks to hold on to, because a ton of the calories we consume every day purely go to maintaining our mammalian body temperature. So when we're not fueling well enough, the body doesn't want to burn calories to keep you warm. It's like, no, I'm going to make you feel cold and put on layers so I don't have to do as much work. And it changes our brains. Our brains during malnutrition, and this is, these are generalizations. Not everyone has every one of these, but often people can be like, oh yeah, I do sort of remember parts of that. Our brains, when we're starving, necessarily become less creative, less playful, less relational, and less joyful and spontaneous. Because like the mammals we become more serious, focused, neurotic, worried, reactive, anxious, because we're just animals that don't have enough food. And it's so remarkable when people do begin to nourish again, they might say, oh my gosh, like I'm laughing more again. I forgot about laughing, or I'm looking forward to doing things. Or if a friend spontaneously invites me to do some activity I wasn't planning, I don't panic anymore. So that cognitive change is really marked. And then we have sex hormone changes, testosterone, estrogen, and many more. But those are just a few of the medical things that happen when people aren't nourishing enough.
Thank you. I know that I actually am curious. I'd like to talk about periods at some point.
I'd love to talk about periods.
But Angie, would you like to ask Dr. G anything while you're here?
Well, I just playing off of that topic, Dr. G, I'm just curious. I think this goes along with what you said, but I remember this is odd, but one of the only things that I felt was not a good thing, but that didn't bother me when I wasn't eating was that I slept like a baby. I mean, I slept like the best I've probably ever slept in my entire life every single night, like consistently, just like sleeping like I was, nothing could wake me up. Is that normal? I mean, is that just, I would assume that's just another, like your body's just shuts down at night, like, good, I don't have to work anymore. But is that a common thing? Because it's one of the things I associate with that time in my life is like, well, a lot of things sucked, but I slept so well.
I always love hearing people's stories because I love fitting them into what makes sense to me with the science and then honoring the uniqueness. So it is true that fatigue and a need for so much more sleep is common when you're undernourished. And this could be anorexia nervosa, atypical anorexia, bulimia, binge eating disorder, any of the other ones, disordered eating, relative energy deficiency of sport, malnutrition in general, we need more rest. And our body calls to us to rest more. And of course, given our ableist culture, the first thing people think when they don't have energy to do the workout they want, when they don't have the energy to do something during the day is, I'm not showing up enough. I'm not, energetic enough. This is a problem with me. I'm being lazy. When in fact, once again, it's our cave person brain saying, please rest. I like to remind my patients that bears, when they hibernate, sleep. They do not go to school, work a job, take care of relatives, go on social media. They just sleep when they're not eating. And so that drive to sleep is common. What's so interesting, Angie, is that actually a lot of people say that the reason that they're happy to recover is that their sleep comes back. So oftentimes when people are malnourished, their brain becomes so anxious and ruminative about, what did I eat? How much did I eat? How much did I work out? How is my body? What am I going to eat tomorrow? That they can't find rest. And that feeling is something I sometimes characterize as the now I lay me down to sleep feeling, where it's like your mammal body knows things aren't okay. And it's a little nervous to sink into the vulnerability of sleep, because it's like, I have not gotten what I needed today and may not tomorrow either. So what I will say is, what a blessing that you were able to sleep well during this time that many other things were not going well. And also other people might be like, that was actually the opposite for me.
Yeah, I mean, it was definitely surprising in that like the rest of my waking hours were anxiety filled, but I don't know. I just thought maybe it was my body like giving up at night and finally feeling like it could rest or something.
Yeah, we'll take it. Thanks, body. Thanks for
Yeah,
giving me that moment of
nice.
peace and rest in that moment.
I actually have a question as well that's kind of like related to what you had been saying about changes. I like noticed at one point I had a doctor, my metabolism was like incredibly slow at one point. Well, it still is, but I had a doctor who told me to take birth control pills to protect me from like osteoporosis and stuff. And this was like in my like mid 20s, after I'd probably been like 10 years since I'd eaten normally, and my like body just completely freaked out, and it like put on weight just nonstop for a year. I gained like probably like 30 to 40 pounds like within a year, and my metabolism just like never adjusted. I was working out, like I ran twice a day, I climbed twice a day, I would like lift weights, and like it just didn't do anything. And I've like noticed that slowly like my metabolism has like normalized a little bit, but I'm just wondering if that ever like, if it ever goes back to normal, if like your body ever just like starts being normal again.
Those are a couple of just phenomenal questions. And there's a lot of great stuff to unpack from that. So the first thing is about bone density and malnutrition. So let me address that first, and I'll get back to metabolism. I adore the topic of metabolism. So when people are malnourished, their cave person brain says it is not a safe time to expend calories on sex drive, having sex, or procreating. And for people who menstruate, it's not safe time to lose that vital body resource of blood every month. Let's shut it down. So the body reverts sex hormone production to pre-puberty. And in fact, in people who have ovaries and uteruses, they shrink back down to pre-adolescent sizes even. Everything goes quiet. So when I'm talking to people who may have erectile dysfunction, I say, was there a point in your malnutrition when you stopped waking up with erections, or when you noticed your sex drive really fell? And when I'm talking to people who menstruate, I'll say, at what point did your period start to become irregular or absent? Really important to say, everyone's on a bell curve. So I have plenty of patients with significant malnutrition who never stopped having a period. And of course, their eating disorder uses that to be like, see, you're fine. You still have a period, keep going, go harder. And many people don't develop their period again until 2 years plus into a lovely, complete body and soul recovery. So everyone's on a bell curve. But it's true that when you're not making sex hormones, regardless of gender, you're going to be resorbing bone density faster. And everybody in our bodies, we're always making and resorbing bone. So we put on a bunch of bone density, like we get really the strength of our skeleton from about age 10 to 20, approximately. And after that, we're making a little and we're losing a little. When your sex hormones go away, you really resorb bone fast. And when you're malnourished, you stop making bone. So people can get significant bone density really early. And again, I have patients who've been sick a long time and they have normal bones and they're like, see, I'm fine. My body's happy with this. And you're like, no. It's a whole human picture here. You just have amazing genetics. Good job, body. Thank you so much. But bone density can go down really fast. And so in the past, doctors for people who menstruate would be like, oh, I'm just going to put you on the pill. We'll jumpstart your period. Everything will be fine. We'll protect your bones. Turns out that's not true. And study after study has shown that birth control pills do not protect your bones because of the way that our liver metabolizes oral estrogen. So the new standard of care for people who've stopped menstruating is to use patch estrogen and then once a month oral prometrium or progesterone that will sort of protect your uterine lining. We now know that athletes without eating disorders who have low estrogen levels, when they're given patch estrogen, have better cognition, better memory, and their bones absolutely get better as well. So that's like the standard of care. It's not birth control. So if you're having sex, you don't want to have a baby, you got to use backup, but it is the hormone treatment to use for people under 50. And for those on testosterone, testosterone is the protective factor. Now, for people who are elite athletes who are going to be tested for testosterone, it's a no-no. You got to just do it the old-fashioned way with rest and nutrition. And then the testosterone sort of comes back to life, as will estrogen eventually with sufficient rest and nutrition. So unfortunately, you, like many, were given crappy advice early on. I have no idea whether the birth control pill would have influenced your weight at the time. It might have been true and unrelated. Because when I hear your story, I am once again filled with wonder at how miraculous people's bodies are. Because it knew I have been malnourished for too long. And something protective in you kicked in. And it said, nope. Even if we're not eating that much more, we are going to get this weight back to a safe place, damn it. And your body will just do it because your body is a genius. You know, we're so often bombarded with stories of like, here's 5 ways to control your body. If you don't control your body, these 4 different things are going to happen to you that are terrible. That's an anti-feminist, it's an anti-humanist perspective. Bodies are unbelievable. And so your body just said, I am here to protect you. I got you. Now you, living in the climate that we live in, living in the sport that you live in the family, in the surrounds, we're like, what is going on? Because the math doesn't make sense. But the reality is that our simplistic view of the math, calories in, calories out, it's only like barely scientifically relevant. And our body's profound need to get back to our genetic set point weight and protect us from deprivation is unparalleled. So I would say, amazing job, body. Beautiful work. That's exactly what was needed. And furthermore, the whole sort of calories in, calories out thing supposes that your metabolism is fixed. And if you want to gain weight, you eat more. And if you want to lose weight, you eat less. But your metabolism is always there. So you just have to change what you eat. Bullshit. Metabolism is incredibly responsive. So when we undereat, metabolism falls because of your cave person brain thinking, oh, I got you. I'll protect you. I'll need less. If you're in the desert and can't get food, that's okay. I'll need less for you. And then you undereat it by a little bit more, and maybe your weight falls, and then it plateaus. And then people think, in the midst of a starved brain and a diet culture society and people who praise you so wrongly for losing weight, your body thinks, oh my gosh, you think I've ruined my metabolism because now I'm little, but my weight's not changing anymore. I could never eat more than this and be okay because, everything's going to go out of control. It turns out that's wrong. Ultimately, the thing that will get your metabolism speedy, joyful, healed is eating consistently and enough and without avoiding any food group that you're not allergic to. So, having run the nation's top medical stabilization center for critically ill adults with anorexia, I've seen this again and again, that patients would need to be eating 4,000 calories a day to restore 2 pounds of lean weight a week. And you're like, oh, the math, nope, that's impossible. They must be gaining faster than that. The answer is no, because your metabolism goes fast. So the way for everyone to heal their metabolism is to eat joyfully, plentifully, fueling the body, tasting the food, be mindful, give that amazing body what it needs. And for a while, your body might rock it up a little bit because it's protecting you. It's like, oh, good, we've come out of the desert. We're safe now. Let's get a little bit safer in case we go back into the desert. Let's just have some padding. Let's have something in the checking account in case we starve again. Oh, thank you. That is really protective of you. Yeah. But you got to just keep having faith and be like, I'm not going to overexercise this body. Because if you're still, when you were doing that sort of overexercise thing, your body was like, oh, we're still in the desert. Because we might be eating a little bit more now, but clearly we're trying to run away from the saber-toothed tiger all day long and climb cliffs to get away from it. So, get that weight up because we need some resources. And interestingly, probably the thing to do was to do like a quarter of the movement and do deep breathing work and meditate and be gentle and nourish. And then your cave person brain goes, oh, we're good now. And I can trust you to take in what you need and to rest. Okay, all right, I'll bring your metabolism back up, cool. And if we went a little bit above where your genetics would have said your set point is, I'll let that go now. And it'll sort of naturally come back to where your body's kind of genetically meant to be. Whether you love that or not, whether it's optimal for you or not, your body is so smart that it'll do it for you. How do you feel hearing that? Like, how does that hit?
I don't know. I guess it's not, it makes sense. Not anything surprising, I guess. Yeah.
I want to just really invoke a sense of trust in your body, because everything about society, everything about what wants us to spend money on either diets or different clothing or different ways of presenting ourselves, wants us to distrust our body. And only the things that we can spend money on can we rely on to be safe. But the reality is people can be safe in their bodies. And that's bodies of all abilities. That's not saying like all bodies function exactly as people want them to. It's that we don't need to wrangle our bodies. We can honor them, especially as athletes, with rest, with nutrition, and with kindness, even as we're kicking ass and taking names.
I just wanted to acknowledge Katie's here.
Hi, Katie.
I know we jumped in so quickly and
that's Katie. I'm so psyched that you can make it, and Angie and Andrea, and obviously Dr. G, Chelsea. So great questions.
So I had a couple of questions. I'm not sure which one I should start with, but so I'll start with we normally hear about anorexia being mostly related to teens. And so you talk about like getting your period or losing your period. I'm curious how anorexia or even just like underfueling affects hormones in premenopausal or menopausal women.
I love that question. It does. So when somebody has a sufficient imbalance of nutrition and output to trigger that cave person brain, and everyone's different genetically where that point happens, sex hormones will go away. So if sex hormones go away in your 30s, 40s, early 50s, regardless of gender, you're going to have bone density loss, you're going to have decreased libido, probably decreased sexual satisfaction. And you're going to have, worsening skin and hair because sex hormones are important for all of those. I think that, regardless of gender, these sex hormones in general are gender affirming hormones. And so if you're somebody who's assigned female at birth and you don't have estrogen because you're malnourished, you're not going to feel as good. There's going to be something about you that's like, oh, something is missing. And so, one of the tricky things for my patients who were perimenopausal, for instance, is that they're not sure, is it right for me not to have a period because I'm just in menopause now? Or should I be having a period? It's hard to know what to expect. And women can have a hard time going to their doctors and asking, what's normal? What should I expect? And they may feel shame. They may not have disclosed that they're not having sex hormone production anymore. As far as bone density, the treatment is the same. It's hormones, as long as that doesn't interfere with any sport bylaws. And, once we've checked a bone density level until sort of early 50s-ish. And then if people sort of move into perimenopause, hormones are really quite safe with certain exceptions until somebody's through their 50s and can give a lot of relief to a bunch of the perimenopausal symptoms. So the other thing to say, though, is that major life transitions often trigger worsening in eating disorders, and menopause is one of them. It's probably not incidental that around menopause, folks who have become parents may be saying goodbye to kids as they go off to college, et cetera. There's sort of big changes in the household. And that can be something, as just your sort of role in your life changes, that can switch people into re-engaging in eating disorder behaviors and make them vulnerable to that.
Cool. So my other question was related to pelvic floor dysfunction, because I saw your medical minute about it, but I was kind of curious, I guess, to maybe just elaborate a bit more on what exactly can happen. Because I remember one time I fell off a route and I literally peed my pants, and I was like way before I had a kid. So I was wondering, I think back then I felt like something was wrong with the musculature down there. And so I'm just curious, what happens and what causes, how is it related to eating disorders?
Yeah, that's a great question. I love this topic. This is something that I've really learned in the past 5 years or so as I've become an outpatient physician. I didn't get any training in this. I did not know nearly enough. And as a result, I definitely did not serve my prior patients well enough. So our pelvic floor muscles, people of all genders, are the delicate network of muscles slung between your hip bones that hold up bladder, bowel, uterus, etc. In addition, we have, of course, our core muscles, which everybody is into, and our core muscles can be involved in what I'm about to talk about first. But let me do pelvic first. So when somebody becomes malnourished, just like the rest of your muscles become weaker in the process of either weight loss or just not getting enough nourishment in, so do those little delicate pelvic floor muscles. But also, most folks who are restricting calories would agree that they feel tension a fair bit of the time and stress, and they hold it in their bodies. And so a combination of weaker muscles plus tension can result in muscles that don't naturally relax and contract around urination, moving your bowels, or having vaginal intercourse or having, anything per vagina. And so people who have tense but weak muscles can have pain when they put anything in their vagina, pee that's like constant, they're constantly having to go to pee, but they don't really pee that much when they go. Easy incontinence where they might cough or they might bend over and be like, I just peed myself a little bit. And a sense of even pelvic pain, just, sort of discomfort, inflammation. And then in addition, around bowel habits, because the muscles are tense and weak, it may be harder to poop. So constipation, also bloating, just sort of passing gas can become more difficult. So folks can have all of this whole set of problems. And even if they nutritionally rehabilitate, when we're just moving in the world, like our bicep kind of naturally rehabs because we're using it all the time in physiologic ways as we nourish. But unlike that, with the pelvic floor, people may be straining more, or they still may be holding tension. And so the pelvic floor may not rehab, even if you're resting your body and nourishing well. And so those symptoms continue. And again, people can be like embarrassed to ask about this. But the good news is that pelvic floor physical therapists are some of the loveliest humans you will ever meet. They are all over the country. And oftentimes you don't even need a doctor's referral necessarily to go to one. And they can do amazing work. Now, it is intimate work. So for people who have a history of sexual trauma, it's really important to say, hey, I think you have this pelvic floor dysfunction. I think physical therapy would help. And we'll sort of go slowly around that and think about whether the person feels they can consent to engaging in some help. But you can say, we don't even have to start with anything intimate. So let's move back and talk about the core muscles and the abdominal muscles. In addition to the pelvic floor muscles getting tense and weak, we've got a bunch of muscles that really impact digestion and symptoms in our upper core. So our diaphragms, when we take a deep breath, our diaphragms go. If we don't have that lovely deep excursion of the diaphragm as we take deep breaths, if we've gotten so tense and our muscles have gotten so bound up that we breathe shallowly, and if our other core muscles are so tense, because there's also this premium on like a flat stomach, and people are often conscious of that and they hold in their stomach. So there's that sort of internal corseting effect. Then when folks eat, their muscles may bind their stomach so that even if their stomach motility inside the organ of their stomach is normal, which it might not be from starvation, the binding of their stomach from the outside by muscles can make them feel full, nauseated, can cause reflux of acid and stomach contents back into your esophagus or even into your mouth. And it can make you feel more physically anxious, because if every time you eat, you have these awful symptoms, you're like, oh my gosh, I feel terrible. And it's a further physical impediment to doing good rehab work. Furthermore, when your diaphragms aren't doing their full thing, they're not massaging the intestines. And our intestines actually like a regular breath by breath massage that keeps your digestion and your gas moving forward. So for somebody who has these symptoms, it's always worthwhile to refer them to a pelvic floor PT. And you can start just with abdominal work, which may start with breathing work, like deep belly breathing. It may involve manual sort of relaxation, manipulation of the upper abdominal and diaphragm muscles to ease what's called myofascial restrictions, or that tense sort of scarred down tissue. And I mean, oftentimes patients come back from abdominal wall work and they're like, oh yeah, then I have my best poop of the week. They just feel like so good, and their nausea decreases and their tension decreases. And they say like, oh, when I was anxious, I would have trouble breathing, but I can breathe again. And of course, that helps with athletic performance too. And then if folks feel comfortable, pelvic floor PT itself, just very intimate. It can involve, something per vagina, a finger in the vagina, a finger in the rectum. that can completely change people's symptoms. So I have a patient who's 19 who, after doing a round of pelvic floor and abdominal wall PT, said she had sex comfortably for the first time. She's pooping great. She's no longer bloated. She pees normally, and she doesn't have pelvic pain. And it's just like, well, that's very satisfying. And it involves no medicine, which is, even better.
Thank you.
I've never heard of this before.
I hope that a bunch of people listening to this are like, I might have some of that. Huh, maybe I'll get looked at. And if you just Google, pelvic floor PT near me, and you look at the reviews and you sort of see how you feel about the practice, they're amazing.
Wow.
I think this is a really good example of the fact that just how your film, Caroline, opened up the door to talk about this stuff. And now here's an example of how we're continuing the conversation. Hopefully people will watch this. There's so much to learn and to relate to. It's mind-boggling. And just thank you for going into detail about this stuff. Oh man, even just hearing about how breathing affects, how it's just all so interconnected.
So everyone, Chelsea was the editor of Light, and we worked very closely together during the process. So just wanted to give you a little introduction, Chelsea.
Yeah, I'm the random person behind the curtain.
Not random. She also shot a lot of the video too. So yeah, these are really interesting topics. I mean, I've not heard of this pelvic floor thing, so it's really interesting. But I know that when I was really struggling, I mean, my belly hurt all the time. It was terrible. And a lot of my friends who struggled also complained about having belly aches a lot. So I think that's something you mentioned, Dr. G.
Yeah, well, absolutely. And I think it's worth just taking a step back, because it's fun to diagnose and treat things properly, but we have to remember how these problems affect the individual humans, because belly pain is a sign that says, like, stop what you're doing. This isn't safe. It's not good. All of us are geared to sort of avoid things that hurt, especially if they don't feel like productive things that hurt. A workout might hurt, but you're like, okay, I'm not injured and I'm being productive. And so when you already have somebody who's in a mind frame where it's really hard to change behaviors, and then you add in physical symptoms that worsen, you feel worse when you try to do recovery work, it becomes like almost impossible, especially in a medical system that like invisibilizes you. Where you go into the doctor and all they can say is like, oh, you look great. Oh, you're doing what? Oh, that's amazing. You're the picture of health. Keep doing what you're doing. And you're like, oh, my eating disorder loves to hear that, but my soul just died a little bit because you made me more invisible and you allowed my eating disorder more power. So, these stomach pains, you can't, there's not a lab for them. Most people's blood work is normal when they have eating disorders. And there's not like a CAT scan that can show this. And, a lot of us are the type of people who sort of believe it when it's done, when you're like hands-on, this was real if I can measure it. But a lot of what happens to our bodies in eating disorders, you can't measure. And it's really tough because people operate within a medical system where if you don't measure it, it's not real, or I've got 8 minutes, I can't talk about something that's not measurable. And that those belly symptoms are one of them. And I do think that, just sort of show my bent towards the world, the patriarchal system that developed Western medicine, of which I am a trainee. I mean, I've had to undo a lot of my thinking about things so as not to cause the harm that I did in the past. Makes us want to brush things off that we don't understand as doctors. So it's very easy to sort of little lady someone, like, oh, your tummy hurts. Okay, little lady. Well, either it's your fault because you had an eating disorder. Like, yes, of course you're going to hurt. These are the consequences, which is punitive and shaming. Or, yeah, it's just your irritable bowel syndrome. There's kind of nothing to do. Sorry, you're so anxious. Oh, you know, like, where does that leave somebody? It leaves them stuck, and it leaves them feeling like they haven't been seen. So a lot of what I do in my practice is try to remind my patients, if you feel it, it is real. I don't have to measure it. I don't have to have experienced it myself. I don't have to understand it. I don't even have to have an explanation for it. If you said it, it's real. Let me think whether I can use my toolkit to ameliorate your suffering, and we'll just experiment together. And, you know, so many of us doctors, me included, are like type A, harm avoidant, anxious people who have low distress tolerance. And it's so easy to be like, oh, you have this thing that's bothering you and I can't figure it out. And I feel like an asshole because I can't figure it out for you. It's probably fine. Well, that's a nice way for me to soothe myself, but it really doesn't serve the patient. So, you know, trying to sort of show up where the patient is and believe their body symptoms. And, you know, for things like abdominal pain, there's a million things that could cause that, including abdominal wall dysfunction, pelvic floor dysfunction, gastroparesis, or slowed stomach emptying. And one that is not talked about that much, which is called small intestinal bacterial overgrowth, or Sibo. And Sibo happens when, you know, our small intestine, all 32 feet of it, is supposed to have very few bacteria in it, whereas our colon is bacteria rich. And it turns out that the bacteria we have in our colon really influences our overall health. When people's digestive motility, that is the speed that the intestines wiggle, slows down, which it always does in any eating disorder, the bacteria from the colon can crawl into the small intestine and set up shop and start growing. And then when they get your food, they're digesting it too early as far as what your body's used to, and they produce a ton of gas because bacteria produce gas. And so, you know, you eat a meal, you eat like a reasonable meal, and you're like, and your stomach is like so painfully distended and bloated, and you're like, have I developed a food intolerance? Should I be avoiding gluten, soy, dairy, sugar? You know, that appeals to the eating disorder or the orthorexic in someone. But it's just Sibo. And so, you know, there are tests, but they can be expensive and they can be hard to interpret. If people have that symptom and they have a history where, yeah, your gut probably slowed down, so probably those bacteria did crawl up, I'll just say, like, let's treat. And what's really lovely, and again, this is where I had to do a lot of learning as a Western physician, the Western treatment for this is 2 expensive antibiotics for 2 weeks. Delightfully, a randomized controlled trial that was beautifully done showed that 2 different types of herbal supplements that you can get off of Amazon, none of which I have any like financial interest in, are non-inferior to the 2 antibiotics. And I'll just let people know because, you know, it's out there and it's really important. They're FC-cidal and dysbiocide, or candibactin AR and BR. You take 2 of each twice a day for a month. And around week 2, some people get worsening as a bunch of bacteria die off and sort of give a last hurrah. But at the end of a month, people's bloating is so much better. And if it's not, we keep looking. You know, not everybody responds to that regimen. Some people need the antibiotics. Some people just need other stuff. I never put people on restrictive diets for Sibo. Do not go down that Google rabbit hole. It is deep and it is orthorexic. And it will tell you that practically any food can make Sibo worse, but just nourish your body, take the herbals, and eat enough that your metabolism stays fast so that your gut has good motility. These are the kind of things that can be so helpful when someone's already doing the incredibly hard work of getting over an eating disorder, but their body feels like shit. And every biofeedback they get is like, this is the wrong choice. Do not eat, do not gain weight. But if we can like validate the lived experience and ease some of the symptoms and be like, oh yeah, of course, this came from your ED. This is not a punishment. We can mitigate this until you're functioning well. it can really help.
So I love hearing all of this medical stuff. I feel like this is a good chance. Can you give us like a very quick little intro about your background?
Yeah, absolutely. So I'm an internist who specializes in eating disorders. I grew up in Northern California, the oldest of 3 girls, and went back east for college. When I was in medical school, my middle sister arrived in college and had developed an eating disorder. And she's been very generous about being willing for me to share that she's my inspiration. And thankfully, she's recovered. And yet watching her struggle for a decade really sort of opened my heart to people who get eating disorders. She is my beloved. And I never thought that I would end up doing this for a living, but I finished my residency in internal medicine and came to Colorado in 2007 because it's awesome. It's a great place to live and raise a family. And I started working for the inner city teaching hospital for the University of Colorado. And about a year into my employment, the head of the hospital, who unbeknownst to me was the world expert in the medical complications of eating disorders, said, who would like to help me grow and run the nation's top medical stabilization program for critically ill adults with anorexia? And, by this point, I think pregnant with my second daughter and with my sister's experience, I was like, yep, me. And so it fell on my lap, and I was so fortunate to help run that program for 8 years. And those are my people. I absolutely love this patient population. And I could still be a generalist, but have a specialty as well, which was the bomb, because I want to be taking care of the whole human. And then about 5 years ago, I realized a number of things. Among them, I really want to see people through many chapters of their lives, because I would fall in love with these patients for 2 weeks in the hospital and they'd go off to other treatment in their lives and I wouldn't be able to see them. And so I opened my own outpatient clinic called the Gaudiani Clinic, which takes care of people all over the US of all ages, genders, body shapes, and sizes. I got really, really involved in the social justice aspects of rejecting diet culture and becoming a size inclusive internist, which has been a really important and interesting learning opportunity for me. I had to challenge a lot of what I was taught. And I work with multidisciplinary teams all over the country to help kind of remove the medical roadblocks from people's recovery journeys.
Does anybody, we have a few more minutes. I have one more question for you, Dr. G, but does anybody?
Wait, Angie, I know Angie
I have a question.
Yeah, go.
Sorry, I have to go soon, but I do have one question that's less medical and more, I don't know. I guess the thing that I've struggled with most recently in the past 10 years probably is just watching the younger generation come up through the same cycle and climbing that I did, that I really struggled with, and not knowing I'm friends with a lot of these people, really pretty close friends with a lot of them now, and watching them go through the same thing, and also still being pretty sensitive to that topic. I don't know if I should be a friend first in just being there and being supportive and just waiting for that person to come around to being ready to be helped, or if I should push harder about, I really think you need help, or I think you need something. I can never tell if it's just me and my experience being triggered, or if I should actually be that concerned and push harder and be the one that's hey, why isn't anybody saying anything? Why is this person not getting help? So I only have a couple minutes, but I'm just curious, what you think. I know there's not a straightforward answer, but that's what I struggle with. So I'm curious what your thoughts are.
I think so many people are in your shoes, Angie. I think that's an incredibly valuable question. There's an incredible dietitian named Marissa Michael, who's based in Oregon, who's done a ton of research on climbers and eating disorders. And she's been a great teacher and resource giver for me, for which I'm filled with gratitude. She gave me a summary of a bunch of studies on climbers' BMI and outcomes in performance. And fascinatingly, while yes, the most elite climbers are at somewhat lower sort of weights or body mass index than their next sort of peers, the things that actually matter for performance are years climbing, hours per week of training, finger strength, forearm thickness. And it's not BMI. In fact, there are estimates from decent mathematical grindings that suggest that body weight itself probably only accounts for 2 to 4% of overall performance. So we've got to like knock out this belief that thinner is better. And you know, I'm aware that most climbers who are involved in these studies are already within a quote unquote normal or lean sort of body size. And of course, it is a strength to weight ratio situation. But I think, you know, so many people's experiences among the ones that were just described in light were that actually when you fuel better, you send harder, you are stronger, you can practice better, your body heals better from what you ask it to do. And so to the extent that any individual wants to, and nobody's required to, because it's a very vulnerable experience, especially if you're recovering or recovered, to put out into the world the energy of, hey, this whole like get malnourished, descend, it's bullshit. No, I reject it. We all have to reject it. We've decided to reject performance enhancing drugs in sports. Why are we accepting body crushing, bone stealing, heart rending underweight in order to do better performance in this sport? Like, no, just no. A, it doesn't work, and B, it's going to mess up your body and your soul. So I think the more people can put that message out into the world, like this is a lie. A study that Marissa did in adolescent climbers showed that almost all of them were getting too few calories, too few carbohydrates, and too little fat. They did okay on protein intake because the country is obsessed with protein. We need to do better in terms of what the coaches are saying, in terms of what the elite athletes, you know, feel comfortable sharing with the rest of the folks who look up to them. And we need to slowly change the culture. As far as the individual, like, oh my gosh, what do I do with this beloved friend? I think anyone with an eating disorder history remembers that there were times when you thought, I'm pretty sure something's wrong, but no one's saying anything. So maybe I'm wrong that something's wrong. Maybe I'm actually doing what's right because I keep getting praised by people for doing this thing that like I know isn't great. So when you're in a safe space with a friend, not in a big group, not when they're exhausted, not after they've just had a bad fall, but like when you're in a safe space, just say, hey, look, I've been there. I might be making a generalization that does not apply to you, but I look at you and I'm worried. Or even it's not about how your body looks, because we know that it's, you know, the vast majority of people with eating disorders do not have visibly underweight bodies, but just the way you're acting around food, your temperament, your personality, your joy for the sport. I'm not seeing it. I wonder if you're okay. And you don't even need to tell me if you are. But if this resonates with you at all, I would love for you to go see a therapist or a dietitian who's an expert in eating disorders and just see what they think. And I like, you know, when people get defensive, because it's not uncommon to get defensive, like, what are you talking about? Now that, you know, everybody does this, I'm fine. I like to say that if you told a friend, hey, you have a mole on your back that looks a little bit concerning, I think you should go to the dermatologist. The friend never says, I do not have a mole. You have a mole. You have a mole that's bigger than my mole. I have 3 friends who have bigger moles than this, and they're more irregular. I'm not going to go to the dermatologist. You know, like, nobody says that. So when we realize that sort of defensive, resistant, pissed, suspicious response, like that is inherent to the eating disorder. So if your friend goes, oh my God, thank you. I actually hadn't really realized that. I will totally go see someone. You're going to walk away being like, actually, maybe they're okay. But if they have that resistant, defensive response, be like, oh, you know, and you might even, if it's safe, you might tell them the mole story just to be like, here's what I observed just then. Because I love you. I'm your friend. I got no skin in the game here. I just told you I'm worried and you got pissed at me. So probably there's something there.
Thank you. Yeah, that's very helpful.
Great.
I have to go, but I'll talk to you guys later. Thank
Thank you.
you.
You're amazing.
Thank you, Angie. So we've got like 5 more minutes. Does anyone want to talk
I
about
kind of have a response to that, because I think out of the group, I think I'm different from you guys in that this is my recovery journey began relatively recently, and it's not something even now I'm out about. And just hearing that story, that those examples that you're giving, Angie, that is exactly what I wish someone had done. And the few people I've talked to, for lack of a better phrase, come out to, it's, you know, they give you that look of like, yeah, we know, you know, and we noticed.
Like,
but they didn't know what to, yeah, they didn't know what to say. And that mole story, I'm gonna memorize that. That's really helpful. But I wonder, maybe the answer to this is so obvious, but I wonder what the value is for somebody like myself who really struggles with opening up about stuff like this. I feel like a beautiful thing that happened after the film came out was so many people started sharing their own personal stories, and social media is like the main way people are doing that. And I almost felt guilt, especially as somebody who is involved in the film and the making of it, for not doing that. And part of it is certainly just my personality. Just being on social media is hard for me. It's like really freaky and weird. But I think the other part of it is still trying to hide a little bit. And so I wonder what the value is for coming out a bit more, whether it's on social media or just to family and friends, how valuable that is to the actual kind of recovery process.
That's such a vulnerable and good question. I just want to like reach out and give you the biggest hug right now, just to be like, oh, you can do this. You got it. I'm so proud of your courage and strength. The answer is different for every person. You do not have to disclose to anybody. You can be as careful with your heart and your soul and this experience as feels right to you, because that is your right to choose for your body. If people feel empowered and supported to self-disclose, wonderful. But if that feels too much, too scary, too risky, at this point, who knows what next year brings, don't. But I would say that eating disorders thrive in the dark. So to the extent you can, share this with a trusted therapist, a trusted dietitian, a partner, a close friend. If you have a few loving people who will witness you and who will check in with you and be like, okay, Chelsea, I see you. What's up? I saw a thing. What was that? Then the ED has less power over you, because they're, even as eating disorders usually start by playing a protective role, they start by making sense. But the way that they develop and grow becomes harmful and damaging. And so there are ways in which, as it progresses, it becomes like an abusive partner where it just wants you for itself. And it wants to be able to have no one around so that it can whisper its mean things in your ears and make you do what it wants. So have a few loving, trusted people and stay curious about your own process of your own self-stigma, or your own, to the extent that the resistance to recovery lies in silence so that no one can bear witness to your journey. Stay curious about that. If it's like, okay, I can talk to people about the food stuff, but I'm really not going to tell them how much I'm moving. You know, sort of try to stay true to being like, let me have a few trusted people who know that extra workout, that was not for joy. That was not to make me stronger. That was compensatory. And I actually felt like shit after it anyway. And I only felt more neurotic, and I only felt more sort of driven and miserable afterwards. So yeah, you can do though whatever you want with your body because it's yours.
Thank you for that. That wasn't the answer I expected, actually. I appreciate that. And sort of a second sort of prong to that is, as people start sharing in the ways that are comfortable for them, but particularly people who share on social media or want to make films of their own, I guess I wonder, you know, if I think there's always the concern that you might talk about something in a way that almost accidentally glorifies it or inspires someone. And I think that has to have something to do with the fact that we went so many years without a film of any kind, whether that be independent or a higher budget film about this topic. I think, you know, it's been like 10 years since the movie Jockey came out. And I think there's got to be, you know, just that fear. People didn't want to touch this. So again, nice work, Caroline. Remember the whole time we were making the film, we're like, oh, we're going to do something wrong and people are going to get super upset. We're going to accidentally create inspiration. But I think if you have any advice for people who want to make their own film or write a story or a book or whatever it is, what are those do's and don'ts, things to think about so that we're not adding more pollution?
I love that. You're right. There's always the risk, no matter what you do, even if you do everything so-called right. There are certain things one can avoid. Using numbers. Here was my thinnest weight. Here was my heaviest weight. Here were the number of calories I was eating, or, you know, here were the things I was restricting. So many people who have eating disorders have in their head, I'm not sick enough to get help, to come to anyone's attention, to change. And that's why my book is called Sick Enough, because everyone who has an eating disorder history is like, oh yeah, sick enough. Yep, got it. But I think in trying to prove one's illness or the like trueness of your story, people can tend to try to emphasize the sick days and how sick they felt, not because they're trying to trigger someone or compete, but just because they like have that sort of, oh, I don't even know if I have the right to tell this story because I wasn't even sick enough, but here's how bad it was for me. So trying to stay away from that narrative, because like, if you had an eating disorder, you were sick enough. No matter what the details were, you know, you were sick enough. And I think focusing on the positives, staying body inclusive, highlighting diverse individuals, both, you know, from in all means of diversity, allows it to be an inclusive experience so that one particular type is not highlighted or glorified or held up as the sort of gold standard of what an eating disorder looks like. But we remember how very, very, very many people there are of all sorts who have them. And I want desperately to continue this conversation and would be happy to at some point if you ever want to, but I do actually have a patient that is probably in my waiting room right now, so I should probably go.
Well, thank you so much, Dr. G. Really appreciate you taking the time. And hopefully, you know, there's so many more topics that I'd love to go into with you. So maybe we can make that happen.
Happy to, we can make it a series, whatever would be responsive. I'm really, really grateful and humbled to be part of this amazing group. So
thank you. Me too. Thanks, everyone.
Thank you.
take care.